So today's topic is on detecting and treating dementia. And I'll start with an introduction, what is dementia? So it's actually a group of symptoms. We cannot diagnose dementia based on just one thing that happens to a patient or one symptom or one sign that we find in a patient. Usually it is a group of different symptoms that we place together and we try to make sense out of it, whether the patient has dementia or not. So it's a group of symptoms that may affect the memory, may affect the way a person thinks, may affect the behavior, and may affect the social abilities of the person. Okay. And sometimes we may find that as we grow older, our memory may not be so good. We can forget people's names or forget an appointment we're supposed to have that day. But in dementia, it's serious enough to affect a person's daily social and occupational functioning. And when we talk about dementia, we're also talking about a deterioration, a decline from a previous level of functioning, which is higher. So there's a drop in the level of functioning. We know that different parts of the brain controls different functions. So the front part of the brain controls thinking, the side of the brain may control visual spatial abilities or language, words and language and things like that. So what happens when a patient gets dementia depends on which part of the brain gets affected. And sometimes for people who have conditions that can affect many different parts of the brain, for example stroke, they can actually have many different parts of the brain that get affected. So they may have a lot of different symptoms of dementia coming up. As I mentioned earlier on, memory loss occurs in dementia, but just because you are absent-minded, forget one or two things once in a while, doesn't mean you're getting demented. It is happening to me often enough, but I'm not worried I'm getting demented. So a small degree of memory loss is actually a normal part of aging. Okay, and in Singapore there are two main types of dementia. Okay. One is Alzheimer's dementia, and this is due to an abnormal kind of protein that's deposited in the brain and that kills off the brain cells gradually. The other is what we call vascular dementia, and this is due to poor blood circulation or blocked blood circulation that deprives the brain of oxygen and the cells die in the brain. Also, that's why dementia happens, because cells are killed in the brain due to lack of oxygen and lack of food. And these are some of the risk factors for dementia. With increasing age, the chance of getting dementia is higher. If there's a family history of dementia, it's a risk factor. When they have medical problems like diabetes, hypertension, high cholesterol, obesity and smoking. So these are risk factors for the dementia. Now, when you look at this list, can you make any comment about this list? Okay, some of the things we cannot prevent. We cannot stop time from getting on, so we will all grow older. But it doesn't mean that as you grow older, you will get demented, because we know people who are in the 80s, who are in the 90s, and they're still fairly sharp. What about family history? Okay, again, this is something that we cannot control. But there are things that we can control. Things like lifestyle, smoking. We can stop ourselves from smoking, we can kick the habit, and this is something that's within our control. Yeah? Obesity is something that's within our control. We can eat, we can be careful with our diet, we can exercise regularly, and we can control obesity this way. And same for diabetes, high blood pressure, and high cholesterol. Through a proper diet, proper lifestyle, exercise, and taking medications when we need to, we can actually control all of these risk factors. So out of this list of risk factors, 2 are beyond our control, but the other 5 is totally within our control, and we can do something about that. So as I mentioned before, there are 4 big groups of symptoms in dementia. Emotional symptoms, problems with thinking, physical problems, and behavioral problems. For emotional symptoms, people who are demented can be apathetic. That means they don't have the motivation, don't have the drive to do anything. They can be irritable, small things can make them upset. For example, they can be very demanding. They say, oh, I want to eat food now, now, now. Then they shout for the food, and if they don't get the food immediately, they may have a temper tantrum. They can be emotionally labile. Suddenly, they may think of something sad, and they start crying, but then they can stop crying pretty soon after that. For the thinking, sometimes the thoughts may be vague, so when they try to tell you what they want, they are so vague that you actually don't know what they want. Or sometimes the thoughts may just wander round and round. They can be very repetitive, ask you the same questions. Sometimes I've had relatives who say the patient calls them up in the office 10 times a day to ask, what time is it now? What time is it now? So they can be very repetitive. Other things they can ask about is, have I eaten yet? So they can lose the memory to the extent that they forget they have eaten, and they keep on asking, have I eaten yet? The concentration and the memory will be poor, and they become very indecisive. That means previously, things that they could decide on very easily, like where to go that day, what to eat that day, they find it hard to make decisions like that. In terms of the physical aspects, they may start to neglect the personal appearance. Some of them don't want to bathe, don't want to change the clothes. So sometimes they can end up a little bit smelly, especially if they have urine problems. You know, sometimes they start smelling of urine. And then in terms of behavior, they get agitated very easily. They may scold people, and sometimes the scolding can be very, very bad. I've seen family members that are close to tears because the elderly relative with dementia actually cursing them, tell them, hope you meet with accident, hope your whole family dies off. So sometimes the scolding can be very, very bad. And as you've seen in the video, they may lose their way, they may wander, they get lost, they don't know how to find the way home. So for a person who has dementia, judgment can be impaired. So they may make poor judgment, like if someone were to ask them, oh, can you sign on this form? It's to buy some shares. I think these shares are very, very good, sure to make money. They may sign on the form without thinking clearly about whether it's good or no good. Sometimes things that they were able to do before, like paying bills or even going to the ATM machine to withdraw cash, they won't be able to handle that anymore. As I mentioned before, they get very lost, and they can get very, very repetitive. There's this pet therapy group that brings dogs to nursing homes to visit the inmates there. So it allows them a chance to interact with animals, play with the animals, stroke the animals. So I bring my dog together with my wife, and the inmate cannot recognize us even though we visit every month. So they'll ask, oh, you bring your dog here to visit us? What's your dog's name? Khoo. And we've told the inmate about 10 times before that already. Oh, that's very nice, that's very nice. How many children do you have? 2 girls. Oh, you got 2 girls. And then 10 minutes later, she'll be asking the same questions all over again. What's your dog's name? It's Khoo. Oh, how many children do you have? Oh, we got 2 girls. Oh, 2 girls are? Yeah, very good, very good. So they can become very, very repetitive. Okay, so this is a cartoon to illustrate 2 old dogs. I know what you mean. I can remember someone from kindergarten, but can't tell you who I smelled yesterday. So this is what happens in dementia. Things that happened many years ago, 30 years ago, they can remember very clearly and they can tell you in great detail. But something that happened last week or even yesterday, they cannot remember and they cannot tell you. Okay, I can remember the face, but I've forgotten your name. And this is true. Sometimes patients can be so the memory can be so bad that when they look in the mirror, they cannot recognize the person as himself. This one, even aliens can grow old and get dementia. Greetings from the planet Crouton. We come to your planet to, why did we come here again? Give me a minute, I'll think about it. So this happens, I think it's a part of aging because it happens to me already. Sometimes I go from my bedroom to the kitchen and I can't remember what I went to the kitchen for. Then I go back to the bedroom and then I remember, oh, I'm supposed to get a cup of water, then I go back to the kitchen. With dementia, this gets much worse. I think if you want to understand a bit more about dementia, there's this book that I find to be very good, very interesting, and very illustrative. It's available on the internet, and it's written by a son who had to look after his father with dementia. And the writer, the son, is Tony's husband. So the father with dementia is called Ron husband. So when Ron husband started to forget things, dates, names, where he put things, it took a while for the family to recognize that something was happening to him. And that's just the first sign of dementia. And the dementia took him away from the family. And the son, Tony, turned this story into a very heartbreaking picture book. And this is a very poignant account that will be familiar with families who had to look after a relative with dementia. So it's like a sort of conversation between him and his father. So how did it start for you, Dad? And then the father says, well, it's just like that, forgetting things. I suppose dates, names, appointments, simple things, important things. Example, he got a phone from a friend. What? I'm supposed to be playing golf in 10 minutes? Oh no, I didn't forget. I'll be there right away. And sometimes people in early stages of dementia, they make excuses to cover up. No, I didn't forget. I just late only, just wait for me. So sometimes people with dementia may just leave the home and forget to lock the door, or they leave the keys at home and they cannot get back into the house after that. Sometimes they would turn on the tap and leave it running. And this is one of the things that can get family members very, very upset, because you know how expensive water is in Singapore. And sometimes what can happen is they try to cook, they put the food on the fire, then they forget about this until the food gets burned and catches fire. And this is something that really happens, because I've seen patients and relatives who complain about this. And sometimes they forget about dressing properly, they neglect their appearance, so they may dress up, they remember to dress up nicely on top, but they're still wearing pajama bottoms below. And you know, in Singapore, quite often you see arpics going out in pajama bottoms. So the father was describing when the memories went away, or the relatives left the home and he stayed alone at home, he started feeling lost and lonely, and he started calling the family, the children 40, 50 times a day, asking the same questions. Hello, have I got to go to the doctor today? And the children will tell him, we already went this morning. And sometimes the children get very upset because they're trying to work. They might be in the middle of a meeting with the boss, but the father or mother with dementia calls up in the middle of an important meeting, asking questions like, don't we have to go to the doctor today? I already took half-day leave and got to there this morning. And the children would get annoyed, and later on they feel guilty for feeling annoyed. As the dementia gets more serious, other problems may come in, and the person who has dementia doesn't trust anyone, not even the family members. They may be misplacing things. Sometimes the family members may give them pocket money, they lose the pocket money, or they don't keep it properly. So when they can't find their belongings, they start to accuse family members of stealing the money. What happens in the Singapore context? Who gets accused the most? The maid. And I think hearing the response from you all, some of you may have had this experience, and in the clinic we actually see quite often patients or family members complaining that the maid has stolen money. And sometimes they may really believe the patient that the maid is really bad and has stolen money, and may have changed the maid 4 or 5 times already. So the other thing also that can happen is they start misplacing things, simple things like the key, the wallet, the IC, spectacles, things like that. When they can't find it, same thing, they say, oh, the maid has stolen it. Sometimes they might come up with beliefs, false beliefs that, oh, thieves have come into the house and have stolen my things. Maybe the neighbor has my house key. When I'm sleeping, the neighbors will open the door, come into the house and steal my things. Or quite often it goes back to the maid also, and they start accusing the maid. So sometimes patients with dementia may start complaining to other people, friends or other family members that their own relatives are not looking after them well, ill-treating them, stealing their things, and other family members who are not staying with the patient will believe that what the patient says is true. And what happens after that? They go and confront the person who's staying after, who's looking after him, staying with him, and a quarrel breaks up. So this happens often enough in Singapore. So this reminds me of a true story of an old lady with dementia. So the grandson is my patient, seeing me because he was depressed. And he's depressed by the behavior of the grandmother. That's one of the reasons. The other is a girlfriend problem. So what happened one day is the parents went away on holiday and left him alone at home with the grandmother. And when the parents came home from holiday, the grandmother complained to the parents that the boy is very naughty, he's 25 years old. So the grandmother complains he's very naughty, played trick on her, took away her shoes and hid her shoes. And the parents believed that and gave him a very bad scolding. So if you really think about this, like a 25-year-old who would go and hide the old lady's shoes to play tricks on her. This is another true happening that can happen with patients with dementia, especially those ladies who like to cook, especially the nonias who make fantastic food, fantastic curry. And you know a lot of them have the recipes up here. They don't write down the recipe. And they've been cooking like for 40, 50 years and they always produce fantastic tasting food. So when they become demented, they forget the recipe, they forget the actual amount. So the relatives start complaining, the food starts tasting funny, different from last time. So that happens. There's this joke that I heard originally that this old man went for physical checkup, and then at the end of the checkup, the doctor told the results to the wife and not to the old man. Says, your husband's health seems to be very good, physical checkup was okay, all the blood tests was okay, but you know, he told me, he said something that's very, very funny. He told me that every night when he goes to pass urine, God switches on the light for him. And the wife says, oh, so he's the one who's peeing into the fridge. So I thought it was a very, very funny story. Until my mother started complaining to me that my father goes to the cupboard, opens the cupboard door and pees into the cupboard. So this happened towards the end of my dad's life, about 2005, 2006. Okay, this is a real case example of a case that I saw a few years back. Mr. XYZ is 69 years old, comes frequently to the Family Service Center to demand for financial assistance. The staff at the Family Service Center noticed that he's unkempt, the clothes look like they're not washed. Often he forgets to pull up the zipper, and then there's a smell of urine about him. And at the Family Service Center, he brings up the same issues over and over again. He says the family members are ill-treating him, not giving him enough money to eat, and he says the daughter-in-law from China stole all his money. So despite all these complaints, he refuses to allow the social worker to make a home visit or to contact the family, but he went and made many police reports against his family. When asked how he would like to be helped, he demands to be given money. Other than that, he's very vague and rambling in his speech, unable to indicate how else he would like to be helped. And when he goes to visit the center the next time, he's unable to forget whatever had been discussed on the previous occasion. So this is an example of a man who very, very likely has dementia and not picked up by the family, and the Family Service Center also didn't recognize that he was demented until we had a case discussion and we pointed out that this is actually dementia. So how do you tell whether a family member has dementia or not? So there are 5 simple questions that the caregiver, family members can answer. And this set of questions were developed at NUH in Singapore. Number one, has a loved one been misplacing items or belongings at home? Number two, has a loved one missed any appointment, such as meetings with friends or family members or doctors? Number three, does a loved one has any difficulty managing his finance? For example, when making a payment, can't come up with the correct change. And in the past week, did your loved one read a magazine, book, or newspaper, or watch TV for less than 5 minutes, then became uninterested and stopped watching? Sorry, I lost one question, so this might be a part of dementia. I will try to find the last question and pass it on to NG. Okay. So if you answer yes to 3 or more of these questions, it's quite likely that the family member has dementia. Okay, how do we treat dementia? Medications can help to slow the progression of dementia, and this is one class of medicine, cholinesterase inhibitors. So they work by boosting the level of a chemical in the brain. So in the brain, messages are transmitted from one part of the brain to another through these chemical messages that are passed from one cell to another cell. And what happens in dementia is that there is a loss, a shortage or reduction of these chemicals, and the drugs help to increase the amount of these chemicals in the brain. And these are some examples of the medicine that's commonly available in Singapore. Sometimes if there are other symptoms that the patient with dementia is suffering from, like depression, agitated behavior, paranoid against the main or family members, or having hallucinations, sometimes they can, this reminds me of another example. A patient says, oh, I hear my daughter calling me downstairs to go down and have lunch with her. So she dressed up and she wanted to leave the house and go downstairs and look for the daughter to have lunch with the daughter because she heard the voice of the daughter telling her that. So when patients have these other kinds of symptoms, there are other medicines that can help with these other kinds of symptoms. Main thing is to, for people, I think this applies more to younger people like us who haven't actually have dementia yet. We try to control the risk factors, and as we mentioned, age and family history are something that's beyond our control. But other things like diabetes, high blood pressure, high cholesterol, smoking, and obesity is within our control. And these are things that we can do something about. Lifestyle is very, very important. So it's important to have regular exercise, exposure to sunlight. I think some of the more modern research coming up is that vitamin D deficiency may play a role, and apparently a lot of people are known to have vitamin D deficiency if they have it checked. So sunlight and maybe vitamin D supplement. I think the other thing is to remain socially and mentally engaged and active. What happens to a lot of people who are retired or who have some medical problems or disability? They stop going out. They spend most of the time at home facing the 4 walls. So that can really lead to quite rapid deterioration in the memory and the concentration. So it's important to remain active. Balanced diet, omega-3 supplementation. Some of the other things that not so much evidence, all of these there's evidence to support that these are good to prevent, to slow down the onset of dementia. Other things that we can try to take might be ginkgo, vitamin E, and coenzyme Q10. And finally, what can family members do to help? I think what's important is to understand when there's a relative getting dementia, to understand that some of what they say, some of what they do is because of the dementia, because we've seen family members who get very angry, and what they say is, oh, they're doing it purposely to make us angry. I don't think anyone purposely does anything to make other people angry. So people with dementia are behaving in the way that I have described because there's changes in the brain, because cells have died in the brain, parts of the brain have been damaged or destroyed. That's why they behave in this way. They are not behaving in this way purposely to make you angry or to antagonize you. So people who don't understand it end up scolding the person with dementia, or they end up quarreling. Okay, so this is something that's very important. And how can caregivers cope, and how can caregivers help the patient with dementia? Dr. Lee will talk about this in the next talk. So what we want is, we don't want patients to be at home looking at the four walls, getting more and more demented or more depressed. We want them to be active and engaged. But it's quite hard to get Singaporeans to do this. A lot of the patients we see, we tell them go and join senior activities, things like that. They don't want to go. Sometimes when a person gets demented and unable to think clearly, they can be abused in many different ways and they can be exploited. And it's important that we try to protect them. So there's this Act of Parliament, the Mental Capacity Act 2008. And there's this book available that's available at this website. You can actually download this booklet. And it explains to you the different ways that a person who has lost his mental capacity can be abused and what can be done to protect that person. People who are unable to make decisions for themselves because they lack mental capacity are vulnerable. Because they are vulnerable, and because they lack the capacity, they might not even be aware that they are being ill-treated. So this Mental Capacity Act protects these people, and also anyone who ill-treats them can be persecuted. Okay? And they can be ill-treated in different ways, physically, sexually, emotionally, and financially. If there's good reason to suspect that a crime has been committed against the person, we should make a police report. And to encourage people to come forward and report this, no one the identity of the whistleblower will be protected. And for us, like NG, Wingmoy, and Dr. Lee, we are healthcare workers. If we identify a case of abuse and we make a police report, we will be protected and we will not be in breach of confidentiality. So ill treatment of people who are vulnerable is a criminal offence under the Mental Capacity Act. And the kinds of abuse can be physical, sexual, financial, psychological, or just neglect and omission, like things don't bring to see doctor, don't collect medicine, don't give enough food to eat. Okay? And these are the different organizations that can be contacted to help in these cases. When there's physical abuse, the police, family service centers, and the Office of Public Guardian. When there's sexual abuse, the police and the Office of Public Guardian. When there's financial abuse, the police, family service center, Tribunal for Maintenance of Parents, and the Office of Public Guidance, Public Guardians. And we are concerned about financial protection because of this well-known case that's been up in the news over the past year. And this is the center that does a lot of work for the protection of vulnerable adults, Trans Safe Center. So if you are aware of anyone that's been abused or exploited, you can report to this center and for them to take action. So this is the Adult Protection Team. Now it's been renamed the Elder Protection Team. And I think that's me when I was younger and had more hair. I'm still on the committee now. Okay. This is a website set up by my department with funding from AIC and our angel, Dan Wingmore here. So we set up this website to provide more information and help to the public. So if you click on No, there's a drop-down list and then different conditions, mood disorder, anxiety disorder, psychotic disorders, addiction, and cognitive disorders, problems with memory and concentration. And there'll be a table that opens up dementia and more information about mental capacity. So if you click on this, there'll be more information about dementia, similar to the contents of what I've given in this talk today. And this same website also has a lot of information on depression, anxiety, panic, and things like that. It's available to the public free of charge. Anyone in Singapore can access it. And we have a sort of virtual bookshelf with a lot of conditions, anxiety, depression, panic, abuse, stress, insomnia, and this information may be useful to you or to your family, friends, or colleagues who may be facing some emotional problems. So the website www.thrive.org.sg. So feel free to come to this website and play around and see what sort of information and knowledge and resources you can get on this website. So thanks very much.